Every flush is a clue, if you know what you're looking for. We don't like to think about it, but our wastewater is giving scientists a peek into what diseases are affecting our population. Wastewater testing was a major tool during the COVID pandemic, warning us of new variants, and now it's helping detect other diseases that could be lurking. Just recently, researchers found a bacteria in our LA County wastewater that is resistant to what is called a last resort antibiotic. Drug-resistant infections kill around 700,000 people globally every year. That number is projected to rise to 10 million by 2050 without new treatments. We take a look at what's being found in our water. We talk to an emergency medicine doctor about an increase in cases of norovirus, a potentially deadly fungus, cases growing in California. Fox 11 News In Depth starts right now.
Hello, everyone. I'm Hal Eisner. This is Fox 11 News In Depth, and we're tackling some uncomfortable subjects today. We're going to be looking at detecting diseases before they're widespread in our population and dealing with some concerning surprises. Dr. Adam Smith is an associate professor in the Astani Department of Civil and Environmental Engineering at USC. First of all, thanks for joining us, and then let's give everybody a little bit of a warning here. What you do for a living may be viewed as a little distasteful to some people out there. So be forewarned if you're having a bite to eat at home. This may not be the best time to have a meal, but for the sake of simplicity, you study things that are flushed down toilets.
Yep, I sure do.
And so you need to explain that to us because it's a fascinating area of study.
Yeah, so I work in environmental engineering at the University of Southern California as a professor there, and part of my work is doing research on topics like wastewater and how we can clean our water effectively. And part of that is using wastewater as a tool to track community infections.
Now, this kind of testing, most of us never heard about this before the pandemic because it really kind of happened because of the pandemic, and not because you didn't have anything better to do than look at toilets.
Right. So it was during the pandemic that we found the usefulness of tracking COVID-19 in wastewater. And because that was so successful, now across the country, even the world, we're using wastewater to track COVID-19 and influenza and norovirus, and now antibiotic resistance as well.
Superbugs.
Superbugs.
And so first of all, let's not get there yet. Let's stay with COVID for a second. Mm-hmm. What made you look into toilets to deal with COVID?
Well, we had an indication that COVID infected the GI tract of people, which means that ultimately it's going to wind up in the waste. So that genetic material from the virus will be present, and we can quantify it.
And we weren't doing this kind of study before?
We weren't doing this kind of work before because we didn't have such a widespread pandemic where using wastewater made sense.
And so you got into the wastewater, and maybe that's a really bad image to create. You didn't really get into the wastewater.
No. So for that work, we're collecting wastewater from the very start of a treatment plant, so before it's undergone any treatment whatsoever.
And so you collect it in sample tubes, I suppose.
Yes. So we do collect it, in sample tubes over a 24-hour window of time to get a representative sample.
And as we look at toilets here in the video that we're showing, it's what goes down the toilet that ends up in our water system, yes. and that's where you're taking samples. And when you take those samples, which part of the system and which parts of the system are you taking those samples from?
Yep, so wastewater is basically going from our homes and businesses through the sewer network, and then it's winding up at our large-scale treatment facilities like Hyperion or Joint Water Pollution Control Plant.
All right, testing wastewater can give scientists a thumbs up or a heads up, I should say. I'm going to get a little flush here talking about all of this. Give you a little bit of a heads up on what could be coming in our future, right?
Yes, so an early warning indicator of potential infectious diseases.
Whoever thought a toilet would be a good early warning system?
Exactly.
But it is. And so what are some of the things that you're looking at? You mentioned them earlier, besides COVID.
So COVID-19, of course, was the first one. And then we're also looking at things like influenza, norovirus, and any sort of infectious disease that might be in our waste.
And so you see the bugs actually under the microscope when you're looking at the wastewater?
You certainly can, but what we're most interested in is the genetic material, so the DNA that's present in those bugs.
So explain that a little bit for us.
So basically, we can extract this genetic material, the DNA, and then we can sequence it. And from sequencing it, we can identify what sort of infectious disease is present and how much of it.
So you're finding different things in that water, but some of that is concerning.
Yes.
And particularly about things like superbugs, which we're going to have a chance to talk about here. But when you find things that are down there, you're able to attack them before they attack us. And that's the key here to all of this, right?
Yeah, it's all about allocating healthcare resources. So if a given community, if you see a spike in the wastewater data, then you're saying we need to allocate more individual testing, for example, for COVID-19 to that specific community.
So let's get a little super local here and tell us where these samples actually are being taken from.
Yeah, so our samples, we typically take them from Hyperion Treatment Plant that serves 4 million residents, and then also from the Joint Water Pollution Control Plant, which serves 3.5 million.
And when you take something that's got just that, what was that, 7 million total, are you able to extrapolate out that this can affect a broader population?
Well, that is the difficult thing about tracking it in Los Angeles County. What do you do with data that represents 7 million plus people? Which is why at USC's campus, for example, we're currently doing individual building sampling, which allows us to make more targeted interventions in terms of testing resources.
Yeah, but stay with this super local thing, because Hyperion and the other plants, that doesn't represent the entirety of Southern California, but then your findings do sort of represent the entirety of Southern California?
Well, I would say 7.5 million people is a large enough sample size that we can sort of extrapolate from that for Southern California, yes.
And what do you do once you find these things down there in the water?
Well, it's important to then report them to some sort of public health officials, and then hopefully there's more eyes on the issue.
Yeah, it goes to LA County Public Health?
Yeah, so in this case, yes, these results go to LA County Public Health.
And so have you taken things to LA County Public Health that was found in the wastewater so far that have been a big concern to LA County Public Health?
Well, for example, this study in antibiotic resistance is an example of something that has been disseminated to them. But on campus, for example, we work very closely with student health for the wastewater samples at the building level.
I think, I want to save the superbug conversation for the next segment, because I feel like there's a lot to talk about with that. But, are you still finding things in that water that are COVID related?
Absolutely, yes.
And what are you finding?
So we find a sustained level of COVID in LA County wastewater. The utility, for example, now is doing that routine testing. We're doing testing on campus still. And so there is, of course, low-lying amounts of infection that are happening across LA.
And you're finding that like in the Hyperion treatment plant?
Yep, yeah, absolutely. All of our wastewater in LA is going to be positive for COVID at this point, just because there are still so many infections that are occurring.
It's interesting. We think that that's kind of going away.
And it is. Well, that's one of the nice things about the wastewater data is that now people aren't taking as many tests, and they're taking rapid tests and then not reporting those. We don't have much clinical data from testing to go off of anymore. So the wastewater has actually become very important and useful.
Which could tell us that there's something there more than what we're getting from data elsewhere.
Yes, like cases rising and an outbreak that could be occurring.
Interesting. Adam Smith, don't go away. Stick around. We're going to talk to you in the next segment. Coming up in the next segment on Fox 11 News in Depth, we'll be talking about the superbug and more about wastewater and the very scary things that they're finding in that water here in Southern California. We'll be right back. Don't go away. Welcome back to Fox 11 News in Depth. I'm Hal Eisner. We're talking with Professor Adam Smith, who's from USC, associate professor, right?
Yep, associate professor.
And we're talking about wastewater, and we're talking about the things you find in wastewater, these little microbes that bump around in there. And first of all, I want to explain something we talked about during the break. It's not like this whole laboratory of scientists over at USC. Describe this team.
Yeah, so my team, I have about 6 PhD students at the moment, but a lot of the current work that we're talking about was really just one PhD student's dissertation project that he worked on.
So it's you and a PhD student and a few other PhD, and that's it?
Yeah.
That's a team of superheroes looking for things like a superbug.
That's right, in this case, yeah.
That's extraordinary, and so talk about the superbug.
Yeah, so antibiotic resistance is something that we're aware of and concerned with. So it's when some sort of bacteria becomes immune to an antibiotic.
And so this is what they call a last resort antibiotic type situation?
Yeah, so in this case, we specifically looked at colistin, which is known as a last resort antibiotic, meaning that if you have an infection that is not treated by, let's say, penicillin, a doctor might prescribe something like colistin to treat that infection.
We're always told by our doctors, by the pharmacists, take the full course. If you've got a 10-day course, take all 10 days of it. And that's because?
That's because you want to make sure that you kill off all of the infection so that it doesn't reemerge.
And that infection, that bug becomes stronger when it's less resistant, when it's more resistant?
It can. So anytime you take antibiotics, there are microbes or bugs that are going to survive, and they're going to have some sort of resistance to that antibiotic.
And what can we do about this? I mean, as we're going down there, we're learning about this stuff in the wastewater, but what can we do about it?
Well, for our city, we're kind of raising an alarm about the possibility of increased antibiotic resistance in LA County to these last resort antibiotics. And so what we're advocating for is more routine testing of our wastewater for antibiotic resistance.
This particular bacteria, were you looking for it, or did you just kind of like find it? It showed up and went boo.
In this case, we were specifically looking for it. So we were looking for microorganisms that grew in the presence of colistin, this last resort antibiotic.
And so when you found it, what was your reaction to it?
Well, I mean, it's a little...
I mean, you were looking for it,
Yeah.
but it's like, oh, there it is.
It's a little frightening, but it was something that we wanted to characterize more fully.
And what do these bacteria do?
So in this case, we found 2 bacteria that were resistant to colistin that are considered opportunistic pathogens, meaning that a regular healthy individual, there's no risk that's posed, but if you are immunocompromised, it could be a risk.
And so these things get stronger, and as we learned from COVID, suddenly there are evil things out there we didn't know existed?
Well, the unfortunate reality about antibiotic resistance is it can be what we call mobile, meaning that bacteria can share it between each other. And so then you have this risk over time of bacteria becoming resistant to all antibiotics that we have available. And there have been reports earlier this year in gonorrhea cases that are resistant to all antibiotics.
You were looking for that thing. What's out there that you may not be looking for?
That's a good point. So antibiotics, there's a ton of antibiotics on the market. There's a ton of resistant genes that you can be targeting. So it's difficult to do sort of a broad survey of all antibiotic resistance.
Sounds like there's a universe.
Yeah.
It does. It sounds
Yeah.
like, a planetary system. There's stuff in there that is like some organization of bad things,
Yeah, even though we can't see them with the naked eye, bacteria are incredibly diverse. So what you see in a wastewater sample, there are thousands of different types of bacteria that are
And there are
present there.
thousands of bacteria in just a small area, right?
Absolutely, yeah.
I mean, they're teeny tiny little things. So this is stuff we worry about because this is stuff that can make us sick and even kill us.
Yeah, so it could potentially get to that point. So even in 2016, there was a case of a colistin-resistant E. coli infection that did cause a death.
And so we learned from that.
Yep.
And what did we learn from that?
Well, I think that sort of advocated for more of this wastewater surveillance. So that's one of the reasons why we were looking for colistin in LA County wastewater. There was an early indicator that it existed in 2016.
If it's resistant to one thing, can it be resistant to other things?
It can, and so we call those the multi-drug resistant bacteria or superbugs.
And those superbugs is that what we're looking at right now on the screen? It's sort of a representation of what a
very well
superbug
could
might
be.
be like? Because that's what they are. They're things that are just look like little Rice Krispies out there.
Right.
And so in that is a thing that exists that can be very harmful to us and our existence.
Absolutely. Yep. And so I do want to emphasize, though, so we're looking at wastewater as sort of an indicator of community health. It hasn't undergone any treatment. So there's not really a risk in our drinking water or if you go to the beach. But we're saying that within this sample that represents the gut microbiomes of LA County.
But you're not just looking for the particular superbugs. I mean, there are viruses out there, there are other
Absolutely,
things out
yeah.
there, and you're looking for all these sort of things. But I think your point is taken, that you're looking at the community health.
Right.
You're not just out there looking for bad things. You're looking for the entirety of our community health. So on a scale of 1 to 10, 10 being best, what's our community health?
Ooh, it's hard to put a number on that.
It's hard to put a number. I'll bet it is hard to put a number. But as you continue to study, we'll have you come back, and maybe you can do that at some time in the future. Adam Smith, PhD, thanks for joining us. Sure appreciate it. Fascinating stuff that you guys do over there at USC. Coming up next on Fox 11 News in Depth. Seems like we hear about the spread of some new diseases every day. Now the buzz is about the spread of norovirus and a potentially life-threatening fungus infection. Should we be worried? We'll talk about that in the next break. Be right back. Don't go away. Thank you very much.
Thank you so much.
Good to see you. There we are. The CDC is warning about a potentially deadly drug-resistant fungus, with California and Nevada having the most infections. It sounds pretty scary, right? But is it a potentially deadly drug-resistant fungus? Matt Waxman is with us. Matt is a USC professor. He's an emergency room doctor. He's a guy who knows an awful lot of stuff. And can you explain to us exactly what we're talking about here with this virus?
Yeah, so I think we're talking about a fungus called Candida auris, which was first identified in 2016. It's a newer species of a very common fungus, Candida. And it is interesting to us medically in that it has been resistant to our most strongest antifungal drug, that class of drugs. If you go to the gym or you're at work, you're not going to catch this fungus. This has really only been seen among our sickest patients in hospitals.
This was announced by the CDC on Monday. The Candida auris, or C virus, as it's called, first detected in 2016. Is that right?
Yeah, it was first detected in 2016 in the United States. It'd been seen in Asia previously, and auris is Latin for ear. So it was isolated from a woman's ear in an intensive care unit. And that's really where we've seen this infection in hospital settings and patients on ventilators, immunosuppressed, living in nursing homes.
And then we come along down the road to the COVID-19 pandemic. And does that play a role in all of this?
Well, it probably does. I mean, there's a reason we think with climate change that we're seeing the emergence of a lot of these infections, and older infections we're familiar with behaving a little bit differently. In the case of Candida auris, the thought is, and there's been some interesting research on this, that warmer climates are possibly allowing the fungus to survive at higher body temperatures that humans live at. So traditionally, fungi did not live, at temperatures as close to our human body. Now with climate change, they're adapting to live at these warmer temperatures.
We're hearing about an increase in the number of cases. And I think one of the things that's concerning is that the CDC said the fungus is an urgent threat because of its resistance to echinocandins?
Yeah, echinocandins. That's a class of antifungal drugs that is very, very powerful. It's not something you're going to usually get a quick prescription for. It's something we often use in the hospital. And that drug, the fact that Candida auris has a lot of resistance to it, is very concerning to us.
We've been talking about antibiotic-resistant diseases, and that is a big concern, isn't it, Doctor?
Oh, it sure is. Antibiotic resistance is I think the biggest concern for those of us that work in emergency medicine, infectious disease, and it is a global health priority.
And so in the emergency room where you are, what are you seeing there that's coming in the door?
What we see is patients that are older, immunocompromised, have a lot of contact with the healthcare system, such as dialysis patients that are coming in with urinary tract infections, for example, that 20 years ago were sensitive to most of our antibiotics, and we're seeing so much more drug resistance. We generally will have some cultures on them if they've been in the system before and see what drugs their bugs are susceptible to. And we see that 2, 3, 4 classes of drugs have resistance in patients that have been on antibiotics for a long time.
You'd think that after all this washing of hands and wiping with different kinds of products that we would be in that practice and we wouldn't be talking about these sort of things.
Well, I think that leads us into, talking about norovirus a little bit, which, is not taken care of by just hand sanitizer. You got to really, really wash your hands. But yeah, I mean, washing our hands is part of it. I think the other part falls on the medical profession, people like me, to really only prescribe antibiotics and patients to take them when they're needed, so the bugs have less exposure to these drugs.
Talk a little more about the norovirus. I mean, this is a pretty broad area right now, right?
Yeah, so we're seeing a real spike in the number of norovirus cases in California and nationwide. Traditionally, norovirus causes diarrhea, vomiting, abdominal pain. It's very, very easy to get. Just a couple hundred of those microscopic virus particles will give you an infection. And we, in this time of the year, are seeing just a dramatic number of cases and outbreaks.
Who's most vulnerable to this sort of thing?
If you work in a daycare center, if you are working in a nursing home, if you are preparing food, you are at more likely to get the infection. But unlike Candida auris, anybody can get norovirus. Outbreaks such as cruise ships or schools where people are close together, eating in environments where you're sitting together, you're more likely to get norovirus.
I think that's where I've heard it most, on cruise ships. And is this the kind of thing that just makes you miserable? Or is this the kind of thing that can actually kill you?
It makes you miserable. It's likely not going to kill you unless you're elderly or you're extremely immunosuppressed on drugs that are suppressing your immune system. It's really just the one where you immediately feel nauseous, you're vomiting, and it lasts a couple days, 2-3 days. And it's important really not to return to work until you're feeling much better, and even then washing your hands very carefully.
It's been a while since we've talked to you, and when we've talked to you in the past, it's always been about COVID. So why don't we just take one swipe here at what's the latest on COVID? What are you seeing at the ER?
Latest on COVID is nationwide, we're seeing about 1,500 deaths per week from COVID. That is dramatically down, but there may be a small spike in new cases. We are not seeing here in Southern California a large number of hospitalizations. And one thing we learned in this pandemic was to be very, very vigilant on the number of beds we have available for patients. The second news for COVID is that the FDA is now recommending a booster for patients over 65 years old, this bivalent booster that covers Omicron and the older strain of COVID.
It seemed like for a while there, it was a new episode of COVID every week. We were getting a new one. It was the Delta. It was the this. They all had names. We haven't heard that in a while.
Well, we haven't heard it because the strains haven't been that dramatic, and our hospitals are thankfully not full of COVID patients on ventilators. But we do have a dominant strain in the United States. It's got a new name. It's XBB.1.5. It is a strain that is, largely we think susceptible to preventing severe illness in vaccinated patients. But that's our current dominant strain.
All right. Very good. Dr. Matt Waxman, thanks so much. Always good to see you. And we'll be back with more Fox 11 News in Depth right after this. Don't go away. And if you haven't already, please check out my podcast. It's called What the Hell, and it's available wherever you get your podcasts, or just go to whatthehellpodcast.com. That's it for this week's Fox 11 News in Depth. Thanks for joining us. We'll see you next time. Bye-bye, everybody.